I'm going to be talking about case study number 4, which is the case of a 20-year-old man who had a kidney transplant about a year ago and has had persistent lower back pain ever since. However, there is no tingling, no numbness, and no weakness, and the pain is very localized. There's also no history of trauma, and after the surgery, he was prescribed with 2 drugs, cyclosporin and tacrolimus, which are the 2 drugs that help prevent the body from rejecting the new transplant. So, the electrolytes that were seriously disturbed during his transplant were the calcium, phosphorus, and the vitamin D. These electrolytes are regulated by the parathyroid hormone, which is the source of the parathyroid gland, which is the gland that is known for responding when there are low blood calcium levels in the body. So the parathyroid gland started to produce a lot of the parathyroid hormone, causing there to be an excessive amount of calcium in the body. And this occurred because the cyclosporin and the tacrolimus steroid drugs that were prescribed to the patient are usually known for decreasing the deficiencies in vitamin D, as well as calcium and phosphorus of the body in the bones. And this has led to cause a disease known as hyperparathyroidism, which is when the body has a great amount of production of calcium in the bones, which is known for weakening the bones and causing a lot of pain, as our patient has, which is in the lower back. It can be believed that this could have been avoided if the patient would be going regularly to get his bones scanned to make sure that the calcium, the phosphorus, and the vitamin D levels are right in his body, and that he doesn't have too much and that he doesn't have too little. That would have allowed for doctors to be able to prescribe him with anything new that he might need to help regulate the calcium, regulate the vitamin D in his bones, and would have prevented him from having any pain, severe pain, or persistent pain as he may be having as of right now. This case can be managed by extra supplements and vitamins, because he can be given vitamins that will help regulate the excessive calcium or the excessive phosphorus and the vitamin D in his bones. The most common effective treatment is to make sure that the calcium and the vitamin D supplementation are sufficient to the correct levels. He might need a little bit of regular physical activity in order to straighten his bones and in order to make sure that everything is well balanced. I have created this diagram, which represents the negative feedback loop that occurs with the parathyroid gland. So I am going to go over it and talk about each step in the process. Starting off with our stimulus, which is when the blood calcium concentration drops, which is what is caused by the steroid drugs that were given to the patient after his surgery. After that, the parathyroid hormone is released because it starts to sense that there is not enough calcium in the body. That then leads for bone to be broken down, releasing calcium ions into the bloodstream. Then the parathyroid hormone stimulates kidney tubule cells to release calcitriol, which is basically a synthetic version of vitamin D to help treat the deficiency of the calcium. That leads for blood calcium levels to increase. And then the high concentration of the calcium stimulates the calcitonin release. Calcitonin stimulates osteoblasts while inhibiting osteoclasts, and the calcium is removed from the blood and used to build the bone. Now, the long-term prognosis that we would assume that would be for our patient would be that over time, the bones will become to recover in their state and become stronger if they get treated well, with good physical activity, uh, balancing out his calcium, phosphorus, and vitamin D levels in the body, making sure he is getting scanned occasionally to make sure that his deficiency doesn't run too high or too low. With a lot of things like that, the bone will start to recover, get stronger, and eventually his lower back pain will hopefully be gone. Overall, this disorder known as hyperparathyroidism could be treated. It could also become very severe. I have, during my research, I have read scenarios of people who have felt the pain through their lower body, so their knees, their lower joints, which could also be very severe. As for this scenario, the pain has occurred in the lower back joints, but it's not something that can have long-term effects if it's treated on time and treated correctly, and if, most importantly, the person makes sure that they're taking care of themselves. The man is 28 years old. He's still in good shape. He can go ahead and take physical activity and do all the things he needs to be able to help his bones become stronger. And yeah, thank you for watching.